Welcome to the Dental Team Podcast. I'm your host, Kiera Dent, and I have this crazy idea that maybe I could combine a doctor and a team member's perspective because let's face it, dentistry can be a challenging profession with those two perspectives. I've been a dental assistant, treatment coordinator, scheduler, biller, office manager, regional manager, practice owner, and I have a team of traveling consultants where we have traveled to over 165 different offices coaching teams. Yep, we don't just understand you, we are you. Our mission is to positively impact the world of dental, and I believe that this podcast is the greatest way I can help elevate teams, grow VIP experiences, reduce stress, and create A-teams. Welcome to the Dental Team Podcast. Hello, Dental Team listeners. This is Kiera, and you guys, I'm pretty excited because I've kind of started doing this thing where I'll go and make friends on Instagram with people that I think are pretty rad. And then when they respond back, I sometimes convince them to go on the podcast. And I'm really excited. If you guys haven't heard of him, you should hear of him. His name is Josh Austin. He is a practicing dentist in San Antonio. He also writes for Dental Economics, which if you guys are not a part of that, you should be a part of that. And he also has his podcast, Working Interferences. So it's super fun. I'm super excited to welcome him to the show, to hear what he has to say. I have no idea what it's going to be. I definitely messed up his name before I even got him onto the podcast. So I'm pretty excited to call him by the right name. Josh, how are you today?
Good. How are you? It happens all the time. People call me Justin all the time.
It's fine. That was me. And do you know Josh from Studio 88? Do you know Josh and Joanna?
I know of him. Yeah, I met him at VOD. So I met him and his wife at VOD. I believe her name is Joanna. Is that correct?
Yeah, you got it. Okay. Exactly. Well,
you guys kind of look alike, a little like you could be related.
Oh, well, hey, I'll take that as a huge compliment.
Yeah, I saw a picture of you with her on Instagram and I had to look really close to tell which of you is which.
Hey, that's a huge compliment because Joanna is gorgeous. I say they're a celebrity couple. But funny story with Josh, I was on a podcast with Josh and Studio 88's podcasts are always recorded. They're always live. And before we start, I had to call myself out and I was like, so I honestly don't know what your name is. I said, I know Joanna, but I don't. I was like, I think you're like John, and he lost it. So it was this uncomfortable moment before we even started recording. And then I did the same thing with you. So I think it's my issue with people with the name of Josh. That's my issue because it's Josh Austin.
Is there an ex-boyfriend or something in the past?
One would think, right? But no. So Josh, I did your intro, but give us a little intro on you. Kind of tell us a little bit about your passion in dentistry, how you got here. And then I'm excited for our topic today.
So you know what? I say all the time, I'm just an average dentist. I'm a normal practicing dentist. I get to review products for Dental Economics, which is really fun.
What's your favorite product that you've ever reviewed?
Oh God. I really love Weave, a telephone company. Shouts to the folks there. I really love this curing light checker, like it's a test to make sure your curing light works.
Yeah, I've seen them. It's like a little pad, right? And you put your curing light up?
Yeah. Mm-hmm. And this one is connected to your smartphone, so it keeps track of everything and it sends you notifications to remind you. And so that one's great. And then I really love the iTero 5D, the newest iTero. So those are kind of like the three favorite things I've reviewed in the past 12 months.
Fun. How did you walk me through growing up and becoming somebody who gets to, review products for dental? How did you even get into that?
Yeah. So a long time ago, we're talking 2007, maybe. I had just graduated from school.
Isn't it pathetic that feels like so long ago, but it really wasn't that long ago?
I know. It was like, how many presidents ago is that? That was like 3 presidents ago. I just graduated dental school and I started a blog called The New Dentist Blog. And I used to just write about stuff that I would find, new products and stuff like that. And so I had met this guy named Chris Salerno through that and through some other things. And he went on to become the editor of Dental Economics. And so he needed somebody to write that column. And so he's like, I know just the guy. And so he called me and was like, hey, I'm now the editor of Dental Economics and I need you to write this column for me every month. So that was like 4.5, 5 years ago. So
wow. So you've been doing that for a long time. That's talk about a fun company, fun job with perks. You get all the cool stuff. You get to review it out.
It's so nice.
And it's for dental. I mean, the iTero, it's not the cheapest product on the block. So lucky for you.
And some stuff I get for free and some stuff I don't. So I had to pay for my iTero. But I got what they call like the KOL or key opinion leader pricing, which was cool, or faculty pricing, as they call it. Even though I'm not Invisalign faculty, so that was great.
Hey, it's fine. You got the perks. You write about it, so yeah.
Yeah, absolutely. Yeah, they got some exposure for it, so it all works out.
Yeah, and then you guys started. So you do that. So that's how you even got into dental. I totally derailed your story. I was really just curious how you becomes. So continue on with your story. How did you get into like your average dentist? You started writing for Dental Economics. You review their products now.
Sure. And then, so, how I got into what we're going to talk about today is a really interesting story. So you asked me kind of what we should talk about. And I said, we should talk about mental health for dentists. And so, it's a huge problem. And I say it's a huge problem, because I started having issues myself. And then I started looking at data and realizing that, a lot of dentists have problems and no one wants to talk about it. And so, we go to VOD or we go to, I don't know, the CDA, or any big dental meeting. And there's all kinds of there's all kinds of lectures on marketing and practice management and veneers and all-on-4 and implants and all sorts of sinus lifts and all sorts of crazy stuff. And there's nothing about like mental health. And it's like, honestly, the most important thing there is, because if you're not in the right headspace, it doesn't matter like what practice management lecture you go see. It doesn't matter what clinical program you go learn about. If you're not in the right space mentally, you're not going to pick any of it up. And so I had an incident that we can talk about. And that really opened my eyes to some things that I didn't like about myself. And so I spent the next 5 or 6 months trying to make those things better. And so what you saw at VOD, that program you saw at VOD, was sort of the result of that, of those months of me trying to do some self-introspection and trying to make myself better. And it's, it's a journey. It's not, I will never get there. It's a journey you never find the destination on. But I'm better today than I was a year ago. And I think that's all you can really ask for.
Well, and I love that. Well, for starters, it was fun to see a VOD. Gosh, back before the whole world shut down, like we actually saw each other in person. And now coming here, thank you for bringing this up, because I'm super passionate. I've done a few sprinklings on the podcast. You never know what's going to come out when you get on a podcast. But I've had a few sprinklings of my own personal life as well. And just realizing, I think that mental health is, at least for me, I mean, I went through a lot of therapy. I had quite a few crazy things happen, and it was almost this walk of shame for me. And I felt like, no, I should be better than this. I remember I worked with a dentist, and I remember she was a really, really phenomenal dentist, and she broke off a file when she was doing a root canal. And I remember at the end of the day, like, super cool office manager here, I like almost lectured her. I knew this girl. She had gone through dental school. I knew her. We were best friends. And I remember talking to her at the end of the day, and I just said, you're better than that. Like, you're better than that. You don't break files. Like, you're better than that. And similarly to myself, I felt like having mental health or even trying to focus on that, I should be better than that. I should know better. I should be able to walk this path better. And the reality is,
not how it works.
It's not how it works at all. And I think we put undue pressure on ourselves when it's not necessary. So if you're willing to share, let's dive into this. I'm excited for today.
All right. So the story. And if at any point you need to edit names out of this or whatever, feel free to.
Okay. All right.
But I'm on these stupid dental Facebook groups. And honestly, like, we can talk about social media in a little bit, but dental Facebook groups are a particularly kind of horrible place. I find them, at least for me, and this may not be true for everybody, but at least for me, they tend to be pretty toxic environments. Many of them are. And because of that, and because of the way that I react to them, there are some people that I've run across in those dental Facebook groups that don't bring out the best in me. And one of them happens to be someone who's a pretty well-known dentist in Jamaica, who has a bit of a following. And I don't particularly agree with some of the things she does business-wise. And I don't particularly embrace her content, per se. And I'm not going to say any names other than that. I don't think it needs to delve any deeper than that. But in a private group, I said some unflattering things about her that were quite frankly sexist. and I shouldn't have said them. And I totally agree with that. I totally agree with the fact that I should not have said them. And it got screen grabbed and sent to her. And then she took it to her group where she released them. And now all of a sudden I had 17,000 angry people calling dental economics, emailing companies that I've worked with, and telling them how horrible of a person I was for this, what was meant to be a joke that wasn't a very funny joke. It had nothing to do with racism or anything like that. It was just a stupid sexist joke. And next thing you knew, I had companies that I worked with cutting off their ties with me, releasing statements saying that they don't condone, I'm trying to remember, bigotry. They used the term bigotry, which was really, that was kind of the low point for me, because I really didn't feel like what I said was bigoted. It was sexist. And I'll be the first to admit that, but that's very different. And so I got really low, really, really low. And I basically deactivated from every social media site and just went away and realized like, hey, this energy that you're putting into all of this garbage is worthless energy. It's not doing anything to make anybody better. It's not making you happier. In fact, it's doing the exact opposite. Like you've got to figure this out. So I started going to therapy, and I've realized through countless breakthroughs with my therapist that many dentists and by extension probably dental team members as well, their lives could benefit greatly by having a therapist in their life. And it's something that no one wants to talk about, but it's hugely important. And I'm not sure I could make it if I didn't have Holly, and Holly's my therapist. And she's just been incredibly valuable in my life. And over this time, this past year, this happened last August, over this time in this past year, I have found my brain has been in the most creative space possible. I've come up with what you saw at VOD, which in my opinion is the best thing I've ever done from a stage. My practice is in a better position than it's ever been. And I'm happier when I go home every day than I've ever been. And it's in thanks to therapy. And this should be something we should be thinking about and be talking about because, especially as a consultant and a coach, you can talk about KPIs and you can talk about management styles and leadership styles and all that stuff until you're red in the face. And at the end of the day, like if the doctor or the team member who's a problem or whatever, like if there's an issue there that needs to be treated with therapy, you're not going to get anywhere with them coaching wise until that's taken care of. It's kind of like the perio disease, right? Of this, it's like this insidious thing that can happen and you can't really test for it. You don't really know. And until you treat it, you really can't do a lot of other stuff. You can't do a lot of other improvement until you've improved yourself that way. And so it's just something that I've decided like, hey, I want to tell as many people as possible that it's okay for them to go get therapy. You certainly don't have to talk about it the way that I talk about it and be as open as I am about it, but it's nothing to be embarrassed about. And when you look at the numbers of some of the studies that have been done as far as like dentists and dental professionals who have anxiety, depression, bipolar disorder, all of these things, it's sick. It's sickening that we don't talk about this more. And so that's kind of the hill that I'm climbing now. It's just trying to talk about it everywhere that I can.
Yeah. Well, thank you for sharing that. And I think all of us, regardless of what the situation is, I think every one of us has a moment in time where we either said something that we didn't mean, we acted in a way we didn't mean. We've been so overwhelmed with business or with work or whatever it is that we get to these low points. And I appreciate you sharing because I think so often we are and I don't know what it is. I don't know if it's our profession as a whole that we have this perfectionist mentality. I mean, dentists, I worked with so many of them, and there's this type A personality. I think even team members in dental practices, you look at our hygienists, like we have a really high strung type A, loves to be perfectionist group of people that we're dealing with. And so it's almost hard to say, I need help, or to recognize or to take that first step. I remember when I went to therapy, and it's funny, my background's marriage and family therapy. That's what I went to school to do. And yet even I was stressed out. And I'm like, this is a joke. It just creates drama. Like, what can they really help and show me? So what I appreciate, it was interesting. I've just found as I've gone through a lot of therapy and I've gone through a lot of healing and change myself, that I tend to cry a lot more than I used to. And
really,
when you were sharing, well, I just don't hold it back anymore. I believe like suffering comes from resistance. So like if you're going to cry, like, I don't know why that hits me. But I felt myself just tearing up hearing your story, because I think of so many people that are hurting out there that, like myself, and we put ourselves on this really high standard. And if we're not perfect and we don't have the perfect home and we don't have the perfect practice and we don't have the perfect KPIs,
which no one does.
Nobody does. And yet we put ourselves to these standards. And I just think of all those people out there that are hurting, that are feeling like they're alone, because nobody does talk about it. So I'm super curious and appreciative. Like, here we go. Sappy waterworks are happening on my end over here. I think it's just because I have so much love and empathy for people like you and me that have gone through this journey, and to see the change and the freedom and the healing and the confidence that it can bring, because I think you step into a more authentic, more empathetic, more loving version of yourself than you ever could have imagined being. So for you, Josh, since you brought this topic up, like, how did you even find a therapist? Like, what did you go and talk to? Because I think so many people are so scared of like, what is the process? And I can share mine. And I think it'll be good to do like a male and a female's perspective. So whomever's listening, hopefully one side resonates with you. But how was it for you? How did you even start on this path?
Absolutely. So I'm curious, before we start on that, because you mentioned a male and a female side. Do you feel more comfortable with a male therapist or a female therapist?
It depends, actually. I've had both. And so it depends. I've like interviewed and gone to see so many different therapists, and I really I'm not based on, I need to have a male or a female therapist. I'm more on who's getting me the results and who do I feel comfortable being fully myself and not being judged. So that's really what I look for.
For some reason, I find it much, this could get deep into family stuff, but I find that I'm able to be much more open and honest with a female therapist. I've had both as well. And I don't know why that is. And it may not even be true. Like if it may not extrapolate out to actually, I don't share as much with a male or not, but at least in my mind, I feel more resistance with the male. I don't know why.
Could it be, here's my like psychologist here, like popping in like all my undergrad studies. I'm curious if I know a lot of male dentists will tell me that going to to events, they are more competitive with their male doctors. And so when there's males, so I'm curious if maybe it's this like, and again, like who knows?
Testosterone fest.
Yeah. Do we have to like be a certain way, or if I'm willing to share this? And again, I don't think that that's the case, but again, I think when you're going to like find who you're most comfortable with and don't judge yourself for who you're more comfortable with.
It could be, my dad passed away when I was young. So it could be that there's, male role model issues and things like that. But I think what I want listeners to get from that is that we've both had more than one therapist. This isn't like a high school sweetheart thing where you meet the first one and that's your therapist for life, right? Like there are totally times, and there are therapists that people will click with and not click with. So for me, it actually started on an app. And this was probably a mistake, but it was the step that I needed to get to the point where I was ready to actually do therapy. And so I started on Talkspace, which is like BetterHelp, or it's one of those therapy apps, right? And we would text mainly. You fill out a questionnaire, they put you with a therapist based on how you answer those questions. And then we would text. We would have like a bi-weekly 20 to 40 minute FaceTime, which wasn't enough time.
Mm-hmm, that's short.
Yeah. And then there would be some emails as well, back and forth. And it was fine. It was like, that was what I needed to dip my toe in the water. So it's not real therapy, but it can at least sort of prime your pump. And if that's like the little baby step you need to make to get you into real therapy, then I think that's fine. For me, it was, I went to the Academy of Marriage and Family Therapist website.
Mm-hmm.
And I just looked for a member who was credentialed in Texas. And I went to about 20 different websites and I read some of the philosophies and things like that on the website.
Mm-hmm.
And I narrowed it down to about 5. And then I called each one of them, and almost every therapist will do a short phone interview with you where they ask you some questions and whatnot. And from my experiences, you can tell really quickly in that 5 to 10 minutes of the phone interview is if you feel comfortable with this person or not. And the third therapist I called was a lady named Holly, and she's based in Dallas. And she's credentialed and licensed in California and Texas, so she can see people in California and Texas virtually. We were doing virtual before COVID started, which is now how most therapists are handling it anyway. And I knew after that first 10 minutes that she was the therapist for me. And so I have had more breakthroughs with her than I have with any other therapy that I've ever had. So she's amazing. And the weeks I meet with her every other week for an hour. It's normally Monday at 5:30. So last Monday at 5:30, we're doing this. And from my discussions with her, she says about 98% of people who would do well with therapy in person will do well with therapy in telehealth. So basically doing an hour-long Skype session. So she's like, there's some things that, if you have some very specific types of psychiatric disorders that don't work as well, where she needs to see you and read you in person. But for the most part, she says Skype works great. And so there's no excuse. Like, you don't have to leave your office. You can do it from home on your laptop or at your office. Like, there's no excuse not to do it. The excuse shouldn't be time or access or anything like that, because kind of all that's gone now, with
it really has.
telehealth, and it works great.
So my question to you, what was and if this is too personal, we can edit out for sure. What was your intention when you were going to therapy? Because I think so often we don't even know why to go. Like, we're like, we need help, but what was your intention when you decided this path?
I had some pretty crummy thoughts about myself after the whole incident that happened with the screenshots and whatnot. My self-esteem went not to the point of like having low self-esteem, but actually like into not liking the person that I was. And that's can be a malady as well as a valuable tool to help you improve. And so it was kind of a combination of the both. So me feeling really poorly about myself based on that event, because it was just like, I'm a 40-year-old man. I'm getting into it and scrapping with these people that I don't even know on the internet and saying things that's affecting my career for a cheap laugh that wasn't even funny. Like, so it was just like, I don't like what I've become. I don't like trying to score jokes at the expense of someone just because we don't get along. So that's really was the impetus for me. There was also some anxiety, some generalized anxiety disorder that went along with that. And I had actually seen I'd seen a psychiatrist here in San Antonio that practices across the highway from me. And I saw her twice. And we spent some time talking. And she, at the end of the second session, she was like, I'm trying to figure out the best way to explain this to you. But she's like, you don't need me. I was like,
okay.
Yeah, I don't like, what do you mean? And she said, you need a hygienist and I'm a dentist. And I was like, oh, okay. So that's an interesting way to look at it. So she basically said, like, psychiatrists treat active mental disease, whereas therapists can help anyone, right? So, a dentist, when I go in to do a procedure on someone and remove decay, I'm removing disease, I'm treating that disease, right? But my hygienist do profies on healthy people all the time, right? And so that's kind of the difference, is that really anybody can benefit from therapy with a therapist, whereas to see a psychiatrist, there needs to be some probably some active mental disease, and not everybody meets that. Not everybody has that. And so I was so kind of away, I didn't understand it at all, where I didn't even know that. I was like, oh, I thought a psychiatrist and a therapist were the same. I had no idea. I was like, oh, I need a shrink, which is like what I take when, what I see in movies about like somebody sitting on someo's couch. You know
totally,
what I mean?
Yeah.
That's therapy. And they always call it a psychiatrist in the movies, but it's not a psychiatrist.
Right.
It's a therapist,
exactly.
Right.
Exactly.
So that's where I would start, is if someone out there is realized like, hey, I've got some depression disorders, things like that, whether it be minor or major depression, anxiety, bipolar, or just have a lot on them and have a lot of stress and feel the need to talk. Like starting with that American Academy of Marriage and Family Therapists, is the place to start. The first person you call is not going to be most likely is not going to be the right person. And that's totally fine. Like you're not broken. That's not, the person's not an idiot. It just is what it is, right? Like, it's very much, this is a weird thing to say because this isn't like, but it's kind of like dating. Never date your therapist. You shouldn't do that.
That's not what we're advocating here, guys. It's just an analogy.
Right. It's an analogy. It's the same, like it's a relationship, right? And sometimes you click with people and sometimes you don't. And if you don't click with your therapist and you're not comfortable with them, you're not going to share and you're not going to get the same insights.
100%.
And that's like where the work is done, is when you're comfortable with sharing the thoughts that go through your mind on a regular basis that may be scary. I've had to tell Holly some things that have come through my mind that are scary thoughts. But I'm comfortable enough with her to know, like, we have a relationship and I know that she's going to treat things appropriately. Right. So, that's going into it, knowing that the first person you call may not be the right person for you that's like step one.
Hey guys, I wanted to let you know something that I am obsessed with. You've heard me talk about it so many times, and that is membership plans. Membership plans are what I used to grow our practice from 500,000 to 2.4 million. Is one of the biggest reasons that we were able to grow our practice. And right now, I think memberships are what you guys should be totally focused on. And the company that I love the most is Clear. That's Kleer. Clear makes membership plans easy for you and your patients. You get to maximize your patient participation and reduce your front office team's time spent on administration with Clear's automated platform, patient self-service tools, and newly expanded suite of marketing tools and templates. They make it so easy. Implementation is fast, virtual, and totally free. So you guys schedule your demo at kleer.com. That's Kleer.com. Let them know the Dentally team sent you. I want you guys to get membership plans. You will not regret it. Yes. I think I was so scared because you have to be straight up vulnerable and hope and pray these people really do follow the code of ethics. But I think it's empowering and encouraging to know that therapists do have to abide by laws where they cannot disclose information about you and they'll tell you if you're hurting somebody, they have to disclose that or certain things. But for the bulk, they are held by the law that they cannot disclose things. And so I really think it's important to, and I don't know, I also love I've used therapy just to grow me as a person. I've kind of gone from therapy to coaches to consultants I've kind of like weaned and waned through a bunch because I think you'll get to a spot where you also outgrow the person you're with, and that's perfectly fine. Like every relationship should come to an end. Every relationship serves a purpose. And so I know when I was going through it, mine was for trauma. I had a lot of trauma and I didn't realize how much trauma I had. And so I remember the first one I went to, I was like, as so many people, I just needed somebody to help me. I knew I needed help, but I didn't even know what I needed. And I think so often we're there. And so I implore everybody to, similar to what you just said, Josh, is to start somewhere. So if it's the texting app and that feels safer, if it's like just calling somebody up, for me, I would trusty Google, because Google knows all. I would write. It knows everything. It really does. I would write in some of the things I was struggling with, and that's how I found out that I was in more serious abuse victim situations that I needed to work through. I also had anorexia issues growing up, and all these things I just thought I could get over. And the reality is, I do think I could have to a point possibly. But why struggle when there's people there that can help you and can help you have breakthroughs that you can't see on your own? So I went through a lot of different therapists. I probably in the last 3 years, I've seen probably 6 different therapists. I've gone through several. For me, I've said this before, especially if you've got trauma from the past. EMDR was it's your eye movement, so it actually.
I was just about to ask you if you've ever done EMDR.
Yes, it's so
we
cool.
Just started it, and I'm not going to say like, one session of EMDR and it was like fixed, because that's certainly not the case. to bring it for anybody who doesn't know what EMDR is, it stands for eye movement desensitization and reprocessing, I think. And so basically what they do is I do it over Skype or and so they have this like app that they control, and they send you a link and you bring it up, and it's this ball that moves back and forth on the screen. Is that how yours was?
Yeah, I've done mine in person, and mine was a light bar. Some do it with sound. There's all different kinds to do
it. It was just like a bar in the room where the light moved back and forth. Okay, so however it works, there's whether you're doing it in person or online, there's this like cue, this visual cue that your eyes follow back and forth. And you bring up a particular, the therapist will ask you about a particular memory that's painful, and really get into some pretty detailed questions about that memory to really bring it up. And somehow it's supposed to like access where that memory is filed in your memory banks, and reroute the sort of neural signaling so that when you think of that memory, not only pain comes up. And so what I found when we would do it is she would ask me something, and I'd be watching this ball, and like a word would pop into my head. And that it was like, there was one time I like saw the text of the word in my head. I don't remember what it was, and that word went on to become kind of something that was sort of a repressed feeling that I had associated with that memory that I would have never come up with any other way. And so I find it fascinating. EMDR is pretty specifically for traumas. The interesting thing was, if you would ask me 10 years ago, like, do you have trauma in your life? I've been like, no, like I've never been in a horrific car accident. I was never kidnapped by anybody. But my dad died when I was a kid. And so, I would have never labeled that as necessarily trauma. Like it sucked, whatever, but I wouldn't have would have said it was trauma, but there are many different things that can be trauma. So it doesn't have to be like you were sexually assaulted or, all of your family died in a car accident. It's not necessarily things like that. Like little things can be trauma that you can carry with you for a long time that can affect your life. And so EMDR, I'm interested to see, how many sessions we're going to do this, but I'm interested in that. Have you ever done TMS?
I haven't done TMS. I will, like, just to double back on EMDR. I actually went through EMDR for a year.
Wow.
So and for me, what was really cool is I actually worked with a therapist who did deal with people that had gone through trauma just like me. So it was pretty intense, and so much so that it would just create like I was very stressed out, and it was demobilizing for me, and I hadn't really realized how impactful it had been. And so what was really cool is because she find a therapist that specializes in what you're looking for. They have them. You guys, I did marriage and family therapy. Everybody has a symptom and an issue that they love. So like as a therapist, things that really resonated with me, I was all about mental health and about connections. Like I really love relationships. That was what I would just get passionate about and fired up about, and I love that. But yeah, I had people in school that were nowhere near involved with that, and they wanted to do about drug addictions, and that was their passion. So find a therapist that has a massive passion for what you're looking for, because they can really help and dive into that. They've studied that for a long time. But for me, it was really cool because I actually didn't have to deal with the memories. All I had to do was think of the memory, and she would ask me on a scale of 1 to 10 how painful that memory was. We were trying to find the actual one that was the most, and all I had to do was think about it, like just identify it, and then we'd move on, and I wouldn't have to actually go through it. So it was really cool. And I can say after a year of going through EMDR, I would say 75% of the memories that used to trigger me, I actually can't remember. So it's actually erased several of the memories for me. So just putting that out there, I wasn't sure. I tried all different kinds of therapy, and that was the one that actually ended up working really, really well for me. So just to double on that, but there's you guys, EMDR, and I mean, Josh, you just mentioned one that I want to hear about more. There's so many different, it doesn't have to be talk therapy, and be crystal clear on what you want. For me, my therapist, I'm always saying I want results. So I'm going to come in here, I'm going to put the hard work in, but I don't want to just sit here and chit chat about my feelings. Give me tools, give me things that are going to make a difference.
Oh yeah. You got to learn coping skills, right? And that's every therapy. So therapists do treatment plans just like we do treatment plans. And so on pretty much every therapy treatment plan, there is something about, but teaching or learning, helping the patient learn healthy coping skills. And so that's really, that's a huge part of therapy is to develop a cognitive system that your brain does without even thinking about it, of healthy coping. And what I found was, when I think back on it, is like, in the past, my coping skills were horrible, and they're still not perfect. And so, different triggers trigger different coping skills. But my coping skills were like really horrible things, or like, I mean, not really horrible things, but like things that were really unhealthy for me. Like when I had a bad emotional day, I would eat like garbage that day. I would eat garbage. And like, because my brain was trying to tell, or some part of my brain was telling me that would make me feel better. And it obviously didn't, you know what I mean? Like, and so now you're unhealthy physiologically.
Right.
And, your brain is struggling with anything. It's like grasping at straws, and you're not giving it the nutrients that it needs. You're eating, you're in California, so you don't have Whataburger, but like In-N-Out Burger. You know what I mean?
I do know Whataburger. I've seen that when I travel.
That's like what I'd have a bad emotional day, and that was like double Whataburger, like Whataburger with cheese, Whata-sized fries, like that was it. And that's, not a good coping skill, right? Totally. And there were other ones that were even worse. And so you just like, I think that to me is the most valuable part of therapy, is like giving you tools that you can use to survive different situations, because you're not going to have a day or a week or a month where you don't have some kind of trigger, where you don't have stress, where you don't have some anxiety. But your body your body and your brain need to learn ways to do with that. And that's what therapy is about.
Mm-hmm, for sure. And I love, I think it's important. I learned this in a class, and they said, practice doesn't make perfect, practice makes permanent. And so give yourself like space and love to realize, hey, you've just trained yourself for years and years and years that when you have a bad day, you go eat Whataburger. Like that just became your go-to. It became an automatic response. And so what's really cool is, I love that practice doesn't make perfect, practice makes permanent, and you can actually rework different techniques, different habits that are more self-sustaining. And so what I love is, I went through therapy, but I've also done a lot with like emotional intelligence and figuring out, like getting into all sorts of cool stuff about my belief systems and why my beliefs. I was just talking on another podcast the other day, and we talked about the biology of beliefs. And what I think is really cool is I think in dentistry, we're so good at seeing clinical and the science, and yet there's science behind mental health as well. And there's actual stats and proof that I think we need to give just as much attention to that side of us as we do to our clinical CE.
Yeah, we don't read that literature.
Because it feels scary. You've got to get like, okay, now I've got to work on me. I mean, it's much easier to put the problem, or say like, hey, I'm going to learn how to do this skill set, and so I can have a better experience for my patients. But I think so often we neglect ourselves, thinking that we don't need as much.
The interesting thing about therapy is that at the end of the day, you talked about talk therapy, right? And that's no matter what, like no matter if you're working on coping mechanisms or doing EMDR, you're still talking, right? Your brain is making words, and you're receiving words, and you're processing them. But at the end of the day, there's no physical touching that takes place. There's no drugs, there's no medication, in the average therapy. It's literally just thoughts and ideas and sharing and giving. And that creates, and this is like in the literature, and I can give you studies, that creates physical and structural changes in your brain, which is fascinating to me, that you can actually change the way that your brain looks under a microscope with therapy, with psychotherapy. And that is just absolutely, like, as someone and as a group of people who do surgical interventions, right? As dentists, that's what we do. We go in and we remove disease, and then we do something physically with our hands to repair that. The fact that you can talk somebody into a structural and cellular change in an organ of their body is fascinating. And I never knew that until I started talking to my therapist about these things. And it's just, it's really, I mean, it's the power of the brain is just mind numbing. It's really impressive.
It is. And so what I love today is that thank you for being vulnerable. Thank you for sharing, because I think the more that I have a really dear friend, and he said, Kiera, I appreciate that you and he and I have serious conversations often about mental health, because he went through, he's not in dentistry. He's gone on his own path. And he just said, Kiera, I think so often people don't talk about this. And I was like, it's not a think, it's an actual fact. People don't talk about it. I feel like for me, all through therapy, the word weak came up constantly. Being a girl, I'm so weak. Thank you, Taylor Swift, for releasing the song, If I Was a Man. Like, that song resonated because I'm like, if I was a guy, I'd be so much further along in life because I'm a girl. And like, it was just this whole upbringing. I grew up with 4 brothers, and realizing that I always thought being a girl was a weakness, and that I was so weak. And so I never wanted to be somebody that showed any different side of me for fear of being weak. I didn't know that, but that came out through a lot of time for me to then embrace, like, no, being a girl is my ultimate power. And like, there is beauty in all aspects of it, but it doesn't have to just be for anxiety or bipolar. It can also be, for me, it propelled me into being a stronger leader, into having more empathy and more compassion, but also not sitting by idly and saying, oh, it's just how I am. It's like, no, there's all these different ways that you can change if you'd like to. And so really taking a proactive approach to life versus just being reactive all throughout life. So I think it's important yes, it feels scary. I remember all my first days going, I was terrified. I was shaking. I had sweaty palms. I'm like, who is this person? And do I really trust them with my life? To where towards the end, you guys, I've seen so many different therapists that I'm like, all right, here's my story. It's almost just like rolls out of my mouth now. Here's my story. Here's my life. Like, let's get to work and fix this. And they're always like, wow, you've done this. And I'm like, whatever. You have to know me 100%. Otherwise, we're not going to make any progress. So I think really being transparent and open and trusting somebody else, because like you said, I feel like the word you've said so many times is breakthrough. The breakthroughs you've had with somebody else has opened up a whole different version of you. So I love that. And I would say, for anybody out there thinking about this, or if you've wondered, like, shoot, Josh is here, I'm here, reach out. It can be a really scary thing, but to know that there are people just like you, and that you aren't better than this. This is just part of life. And I think the sooner you can embrace this as part of life, it's just a whole nother avenue that you've never explored. It can make you a more dynamic person, at least from my perspective. And that's what I would probably end with of it's a beautiful thing. It's a beautiful healing process. There's hard work to go through. I've cried so many times, like alligator tears. I've laughed at, like, belly laughs. I've sat and pondered. I've had my mind just spin in different directions that I've never even thought of. So I feel like it's taken me kind of on an emotional roller coaster of all sorts of different feelings and emotions. But at the end, I feel like
But that's the path. Like, you're better for going through that, right?
Yes. And I feel like my mind, I would say, when I came out of the experiences that I had in life, I realized it was my mind. And if I could learn to control my thoughts, if I could learn to see myself not as this being that was acting, but I had direction over that, and I could actually learn and like strengthen that skill, that's where I became very empowered. And so I'd say, like, it's just another avenue to become a stronger version of you. So those are my last thoughts. Josh, any last thoughts you want to add on to this? I love this topic.
I think it's important. So I spent a good amount of time over the past, this was probably a quarantine activity for me, of trying to figure out a list of what are my emotional triggers. What are the things that happen to me on a regular basis that cause me to spiral, that cause me to question myself, that cause me to be a person that I don't want to be. And so, I encourage everybody. And so, like, here's an example. So, when I think about triggers, there are things that make us uncomfortable. They highlight our self-doubts, and they refresh our frustrations, right? And so, I think if you don't identify them, then how do you learn how to cope with them, right? And because some things, one thing I figured out is, like, some of my failure or some of my triggers are things that I can avoid, and some of them are things that I cannot. Some of them are things that are going to happen. And so the only thing that I can control is the way that I react to them. And so, like, social media is one of my triggers, right? And I don't know, like, is it okay if I bring up Mark?
Yeah, sure.
Okay. So, and I don't want to, like, throw a stone at Mark, because I think Mark is awesome. But Mark's an amazing person, right? Like, from his workout routine, he's freaking shredded. He looks amazing.
He does.
He has this amazing business. He's on private jets or private planes. I don't know if they're jets. I didn't look at the engines of them, so I don't. But they are private planes. He's going to different things. If you look at Mark's highlight reel, it's very easy to question yourself, because like I don't have 14 abs. Like you can't see that. Like he's got that like cut that goes like down like underneath his shorts, you know what I mean? Like at the waistline, like he's just ripped. And so it's like, and he's, got these huge practices and he's crushing it. And you look at that and you compare yourself and be like, oh, he's just better than me. And if you have a feed of that, where every day you're bombarding yourself with that thought, every time you look at that and think that, it flexes a muscle in your arm or flexes a muscle in your body that says, I'm not good enough, right? And if you keep flexing, every time you flex that muscle, you don't flex your I am good enough muscle. And before too long, your I am good enough muscle is totally atrophied and your I'm not good enough muscle is shredded, right? Because that's all you've been doing. And so for me, like there are times like you'll look me up on Instagram or Facebook and I will be gone. So like I take a social media vacation a couple times a year. I try to do 2 to 3 weeks where I'm just off of social media because I know it's a trigger for me. And I know that like it's always there and I need to be on it from from a professional standpoint, but there are times I just need to be gone. And so like if I didn't spend time to figure out what my triggers were, I wouldn't know that, right? And so I would encourage everybody to think about, are you comfortable enough to see a therapist? Think about what your triggers are, the things that send you into shame spirals, the thing that sends you into thoughts questioning yourself and feeling bad about yourself. And try to figure out how to develop coping mechanisms for those things. And it might require a therapist to help you with that. And that's awesome. And it's totally great. And it doesn't mean you're weak. And it doesn't mean that you're crazy. And it doesn't mean that you're not a sane person. It doesn't mean any of those things. It means you're totally 100% normal. And it's totally okay to have those things. And so I highly recommend everybody to just honestly talk to themselves and ask themselves questions about how they feel every day and what can they do to get better.
Mm-hmm. Yes. Such good wisdom. I heard a really cool quote the other day that said, we live in a world that we are inundated with knowledge, but starving for wisdom. And I really do feel right now, these are wisdom, guys. This is stuff that can help. And I would say to finding out your triggers, something else I also loved was finding out my core values. Once I found out my core values that were my core, I mean, you guys, freedom is my number one core value. So if you put me in a spot or a relationship or a work environment where I feel my freedom is gone, I don't like that. I hate it. Like, because freedom for me, like the ability to create and to dream and to aspire, like no wonder my husband and I would always argue because he's very much like security man, wants to make sure everything's safe. And I'm like, no, like we need to be able to travel and be spontaneous and have fun. And so just realizing my core values, again, to tie to your triggers, I think is another really fun exercise.
Yeah, those two dovetail together.
They dovetail
right?
so much. Yeah. So you guys, thank you, Josh, for sharing this. I know all of us can relate in some way. And what I hope is that you guys actually saw how you relate and you're willing to take action, because a true decision is made when action's taken. So do something today, whether it's finding your triggers, whether it's figuring out your core values, whether it's making that call to a therapist, whether it's emailing me and Josh, whatever it is, like you can have freedom, you can have happiness, you can have confidence, you can live the life that you want, not the one you think you should. That's totally possible in a reality. And I love that you've gone through a journey for a year and look at how much more confident, calm, collected, poised, like all the pieces, but still very much you as a person, just I would say a better version of you. So thanks for being on the podcast today.
Absolutely. Thanks for inviting me.
Of course. All right, you guys, that was Josh Austin. If you guys want more info, Josh, how can they reach out to you if they have questions or want to connect?
I would say anywhere on social after I just said that sometimes I'm not there.
DM him, guys. He's a fast DMer. You're really fast, actually. I don't know how you do it. Do you do it on your watch, auto responses?
Yeah, sometimes. Yeah. If you go to search, I'm at Joshua Austin DDS on Instagram. You can find me on Facebook, just searching Joshua Austin DDS, Twitter. If you search for me and don't find me, it's not because I've blocked you. It's because I'm taking a vacation. Generally speaking, I'm back in a few days. So just search for me again. A couple days later, I'll be there. And I'm not going to say it's like I'm gone 4 months of the year. It's like probably 3 weeks of the year. I'm gone off social media. So don't take it. If I'm not there, it's okay. I haven't blocked you. You could always email me as well, jaustindds@icloud.com. We'll put you in my inbox, and I never take an email vacation. So you can always reach me there. But social is probably the best way to find me. Just don't be offended if I'm not there. Try back 2 days later. I'll probably be there.
Yes. Awesome. All right, you guys. Thank you so much, Dental 18 listeners. Thank you, Josh. And we'll catch you next time on the Dental 18 podcast. All right, Dental 18 listeners, that's a wrap. Thank you so much for listening. And if you loved today's podcast, go leave us a review. It takes you 5 seconds, and your review helps more offices, more practices, more team members just like you find out about the Dental 18. Thank you guys so much for being part of my Dental 18 family.